neuropathy is a condition or a common disease that affects 8% of the US population. That's about 24 million people. Now, that in general is just enough of a starter to begin talking about neuropathy and what we can do to help solve this condition. Peripheral neuropathy can occur at any age. It can affect the older or the younger population, predominantly the older population. There are numerous causes of neuropathy, and one of the most common ones is diabetes. 30% of neuropathy cases are diabetic conditions or stemming from diabetic conditions. And I'll tell you the other 30% is from idiopathic or unknown conditions. So what we do know is that diabetes is number one when it comes to neuropathy. We do see that quite a bit. Now, diabetes can occur for a few different reasons. We know that high blood sugar, hereditary, as well as metabolic factors. There's two types of diabetes. There's type 1 and type 2. Type 1 diabetes is usually the inherited one. A genetic factor is always involved. Type 2 diabetes is more of lifestyle. That's where the metabolic factors are involved. But regardless of where your diabetes stems from, if it gets bad enough and progressive enough, it can actually cause neuropathy and sometimes the hands and predominantly the feet. Peripheral neuropathy is actually nerves that basically stem from the spine itself. So the spine is kind of like the hard drive to your computer, the spine and the brain. And all these nerves come from the spine and go to different parts of your body, including the hands and the feet. When that nerve gets impinged for various reasons, whether it's some sort of occlusion or something pinching on the nerve, that can cause less information to go to the hands and the feet, which could mean a multitude of symptoms, which we label as neuropathy. Neuropathy can present as a burning or tingling sensation. It can be a sharp shooting pain. It can be numbness. It can be a motor weakness, such as weakness or tiredness in the limbs. It can be a muscle ache. So all of these are definitely symptoms of what can be present in a person who has neuropathy. Stress doesn't always cause neuropathy. If we're thinking more mental stress, it can definitely be a catalyst for neuropathy, and it can make things worse in the long run. Now, stress to the body, in a physical sense, can sometimes cause impingement and cause neuropathy in that sense. But yes, stress is definitely one of the factors that could make your neuropathy worse or make you feel worse. And so part of our program would include reducing or helping with stress management. There are a few definite early warning signs of neuropathy. One of them is if you have a history of any sort of autoimmune conditions or diseases, that could, fall in the category of diabetes for sure. So being more aware that you could potentially fall into the neuropathy camp if you have one of those conditions. Also, in terms of symptomology, some of the warning signs could be tingling and light numbness in the hands and the feet. It could also be sometimes losing your balance when you're standing or walking. These would be very common early signs of neuropathy. One that we sometimes get is when your hands or feet may kind of fall asleep for longer periods of time when you're laying down or in bed. The 5 stages of peripheral neuropathy Numbness and pain, regular and persistent symptoms is number 2. Debilitating pain, meaning pain that's stopping you from doing specific activities that you'd like to do during your day. Sometimes constant numbness, which would be number 4, meaning that you're feeling numbness just all the time. It maybe varies in terms of severity of the numbness throughout the day, but it's just constantly there and you just can't get rid of it. And then if you completely lose feeling, that would be stage 5. So complete loss of feeling, where if you're, standing, walking, you sometimes don't know what the terrain may feel like. That would be stage number 5. So these are the 5 stages of neuropathy as it progressively gets worse. So in our clinic, we definitely have a system that we take each of our patients through to determine the loss of sensory nerves. So what percentage loss of sensory nerves? So what we do is we take them through a field test where we will have them basically give us a sensation rating based on a series of tests. So that could be a cold therapy, that could be a hot therapy, that could be a sharp push, or that could be a dull push. And so this is what we take our patients through. The testing that we do is going to be very, very specific to the patient, and we'll always compare it to what a normal sensation may feel like. The diabetic neuropathy begins in the gut. So usually it's the way we're eating and certain lifestyle factors. So essentially, what are we intaking during our day? What we're eating with our meals, and how we're spacing them out. Are we exercising or are we more sedentary? So all of these factors can contribute to the start of diabetic neuropathy. Diabetic neuropathy, or diabetes in general, is somewhat of a lifelong condition, and we need to maintain it. And the way we do that is, again, through diet and lifestyle. That's going to be the kind of the foundation of the therapy. Can we get rid of the neuropathy aspect of diabetes? Yes and no. I mean, there is a point of no return when we've lost feeling or sensation in the nerves. And so we want to be able to catch it before we get to that point and start to, stop the process from happening and start to reverse that process of the nerves dying off. If we can do that, then we can definitely get ahead of it and hopefully cure neuropathy once and for all. And then the diabetic part, we'd want to maintain with a nice, healthy lifestyle. That would mean any sort of dietary changes, any extra supplementation, and pairing that with exercises and stretches that the patient is comfortable doing. And everyone that comes to our clinic has different beginnings in terms of how their neuropathy started. And as I mentioned before, 30% of neuropathy is completely unknown. And so what's great about the treatment that we offer is that it does treat most types of neuropathy. Of course, we'd get you into the clinic to see if you'd be a good candidate for our therapy, but there is a core portion of the therapy that really kind of is resounding for all types of neuropathy. The 3 parts that we really focus on for our therapy is the in-clinic portion, the at-home portion, and the at-home portion is there to help to stimulate and regrow nerves and give nutrition to the nerves. And the 3rd portion is going to be the nutrition portion specifically, which is going to help get better circulation to the rest of the body and give the nutrients to feed the nerves to help them stay nice and healthy. So it's a 3-prong approach to really, stopping neuropathy in its tracks and beginning the reversal process. If we get to a point where the neuropathy has taken root and it's been there for a while, sometimes the nerves can die off. And we want to try to really get ahead of this by getting treated a lot earlier before this point, before we get to this point. The complications can be chronic pain, it can be GI or gastrointestinal problems, dizziness or vertigo, and sometimes urinary or sexual problems as well. And so these are very severe cases of neuropathy. And again, we want to avoid this. The most severe case would be a surgical intervention, where if we've lost complete feeling of sensation in our hands or our feet, that could sometimes even lead to amputation. Again, we never want to get to this point, but that's why we really emphasize early treatment with this type of condition. Conventional medical route is usually to start a neuropathy patient off with medication in hopes that it just disappears. Unfortunately, this is not the case. Usually, the neuropathy ends up getting worse. We think of the medication as kind of a band-aid solution to cover up the neuropathy as it's progressing. After it gets worse, we end up making a second visit to the doctor, which then will provide more medications to cover the neuropathy up some more. And then a third round where they'll prescribe even more extreme nerve pain medications to keep numbing the symptoms while never getting to the root of the problem. This can mean, medications, it can mean topical creams, antidepressants to help with the mental aspect of it. And it's just a cascade of, going down this rabbit hole of covering up the symptoms. While at our clinic, we want to get to the root of the issue, start to help with your pain in a more natural way without the drugs and the surgery, and help you get your life back and to be able to go back to doing the activities that you'd love to do, which could mean, something like going back to work, or simply being able to do chores, or going back to a favorite sport-like activity. If you or your loved one is suffering from neuropathy, whether it's from diabetes or other conditions, give us a call today at our San Francisco clinic, and we will help you get scheduled right away to answer any questions and get the process started.